All right, we are on. Welcome, everybody. Thank you so much for joining us on this week's episode of Weekly Dose with Dr. Ude. I have a treat for you. We are going to be talking about reversing prediabetes. So, I have an amazing doctor here with us that's going to be talking to us all about this. Now, before we get into all the details of this, I'm going to start with introductions. My name is Dr. Ude. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine, and I also own an aesthetic practice. My goal is to have my patients not only feeling good, but looking good. All right, so I have Dr. Lola Ashaye here with us today. So I'm going to give you some information about Dr. Ashaye. She is a double board certified family medicine and lifestyle medicine physician with over a decade of experience. She's also CEO of In Touch Primary Care in Sugar Land, Texas, where she helps individuals and business owners to become and stay healthy so they can live fully and enjoy doing what they love. So, Dr. Ashaye, thank you so much for being with us today.
Thank you. Thank you, Dr. Ude. It's a pleasure.
Okay, let's get so when you're talking reversal of any disease process, we are all ears. So this is a big deal. Okay. So, well, I guess before we start with talking about reversal, what is it? So what's prediabetes?
Yes. So prediabetes is when the glucose level is higher than it should be. It's not quite as high as it is when we call it diabetes. So there are ranges. So fasting blood sugar over 100 to 124, 25 is considered prediabetes. Over 126 is considered diabetes. Or if you're using the A1C, which is the average blood sugar over the last 3 months, if that is 5.7 to 6.4, that's considered prediabetes. So prediabetes is before diabetes.
Definition right before it. So, and most people kind of know about diabetes, but can you expand on why it's so important to, reverse this?
Yeah, absolutely. So I really love seeing patients that have prediabetes because I see it as an awesome opportunity. And that's because it's reversible, like fully reversible. And because it's such a big deal to reverse it, because diabetes increases your risks of so many health complications. So people with diabetes have an increased risk of heart disease, increased risk of stroke, increased risk of kidney failure, increased risk of nerve disease, and of even blindness. So there's so many health consequences of diabetes when it's not controlled that if we can prevent it, it makes so much more sense. And then not only that, like there's also the time that it takes to care for yourself when you have diabetes. There's a lot that goes into it, and there's the money. When you have diabetes, you're going to spend more money on tests, on doctor visits, on procedures, on so many things. So there is definitely it makes sense to try to prevent it.
Absolutely. And it's so interesting because I was having this conversation with one of my patients literally yesterday. And so, just like you said, it's very satisfying to catch it at that point and have that conversation of just basically, I tell them, just start walking backwards. Let's get this, let's have you just not step into that at all. All right. So I think this is going to be the best part. So what are the tips? Because that's, I'm pretty sure what they're listening for. What are the actionable tips that people can use starting today to get them walking backwards away from diabetes?
Right. So before I even talk about tips, the thing I like about treating prediabetes and reversing it is that whatever you're doing for it helps your health in general. So you get so much value from trying to prevent it because a lot of the things that we recommend for reversing diabetes is going to make you feel better too. So it's like it's a win-win, you know. So if you have prediabetes, be encouraged. This can become something good because now you could do things that will help your overall health. So one of the things is diet, right? So what do we eat? And so my approach with this is, not talking too much about what they cannot eat, but explaining what they can eat. Because
Eating.
I think a lot of people get discouraged when you start listing out all the things that,
Confused. Yeah.
you, you can't eat this, you can't eat this. So what can you eat? And I think if you have that approach, it helps. So, what can you eat? I think of it in three groups: carbs, proteins, and fats. So, carbs, you can eat carbs that are whole food, whole grain.
Mhm.
So, things, whole food, when you think about whole food, think about things that you can walk outside right now, pluck it up from a tree, or dig it up from the ground. Those are whole foods. So if you can stick to things like that for the most part, things that are food, not processed, things that, when it gets on your plate, you can tell how it got there, not like you're like, I wonder what this is exactly. If you have to ask, then you may want to reconsider eating it. Okay. So that's kind of how I think about it. Can you envision how that food got on your plate? If there are not too many steps, then you're probably that's a good thing for you to eat. So whole foods would be like, a lot of vegetables, obviously. Fruits in the pre-diabetic state, you can get away with eating a lot of fruits still, and you get a lot of nutrients from that. And then, even things like potatoes, yams, things you can figure out how they got if you don't overly process them. And then in terms of whole grains like whole oats, quinoa, um, things like that, brown rice instead of white rice, substituting whole grains for processed carbs will go a long way. So that will be the first tip in terms of reducing in terms of carbs. Now for proteins, I say just try to stick with the plant-based proteins.
Mhm.
So, avoid animal proteins as much as you can. And so stick with, the beans, the legumes, the peas as much as possible. And then you limit the animal proteins. And the reason why is when I talk about fats, which with fats, you can have fats when you have diabetes or prediabetes,
Mhm.
but the type of fat matters. So fats that come saturated fat, which is found mainly in meats and cheese and baked goods and things like that, can increase your insulin resistance, which basically means that your body doesn't respond to the action of insulin in the way that it's supposed to. So if you avoid eating saturated fats as much as possible and you replace with good fat, like fatty fish, like sardines and salmon and that sort of thing, and nuts and seeds, then you're better off in terms of your diet for with prediabetes. So I guess the main things carbs you can eat from all the food groups is just choosing choosing the right things in those food groups. Eating whole grain, whole foods, eating plant-based protein, and then avoiding saturated fats, but eating the polyunsaturated fats like fatty fish, nuts, and seeds. So that's kind of like an overview.
That's awesome. And then, things like hydration, because the other thing I tend to tell patients is, what they're drinking, if it's sugary drinks. So 80% of the time you should be drinking water. And then the other categories can be in that 20%. How about exercise? Would that fit into this discussion?
Yes, absolutely. So when I talk to people with prediabetes, I tend to start with the, dietary changes just because that's where I feel like they can get the biggest bang for their buck in terms of like, changing things. But exercise also is huge. Like there's studies showing that, people that are able to do consistent exercise, which can translate to losing about 7 to 10% of their body, their weight losing weight up to 10 to 7 10% of their weight loss actually reverses prediabetes, and that's people just doing exercise. So exercise, physical activity can be huge because it lowers insulin resistance, and which really helps with preventing diabetes. So yes, people can go that route. In addition, in addition, right.
Really helpful. So, guys, you've heard it. So, it's very important what you're putting in your body. And then there are other modalities as well. You know, what you're drinking, you know, physical activity, even sleep also would, tie in with this as well. So, Doc, I'm going to switch gears a little bit and ask some things about you. And so, the one I always ask everybody is, why do you do what you do?
Yeah, so I think for me, I have a primary care practice and it's a direct primary care, which is membership, like a gym membership. And the reason I do that because I think it gives me the best opportunity to take care of people in the way that I think will be beneficial for them long term. So in direct primary care, people become members of your practice and then they can come in as often as they need to. So that way, preventative care is so big to me. Like it's so like satisfying to be able to say, we prevented this,
Right.
and it's a big. I feel like if you prevent something in one person, that affects everybody, their families, their friends, so many things. So it's such a way to create impact, and I really enjoy helping people prevent serious health conditions. And it to me, it's not that hard. Like a lot of times, it's really just understanding the information, and a lot of people can do it if they have the right support. So in the membership setting, I feel like I'm able to give that support and hold my patients accountable. If they're watching, they'll be like, yeah, they know about that. Um, but it's important for me that, we're able to prevent serious health conditions because I just see how it can be such a big deal in terms of, helping the person enjoy their lives and helping them be a blessing and an impact in their own world too. So it's just really important. Then that's why I do this.
That's awesome. Now, this is completely separate from this. This is the other question I ask. What would you tell your 20-year-old self with all the experiences that you've had so far? And it's in whatever context that you would like.
Hmm. I would say, I hope I would tell my 20-year-old self, or when I was 20, right? Hmm.
Yeah, like
What
if
would I tell myself?
and then you're like, because there's sometimes you think about it and you're like, man, if if I knew this, and it's
Yeah,
all what people say, because I mean, there are people listening to this that are in the same position and could benefit from the experience that you
right,
cite. So,
right, right, right.
of yourself, yeah.
Um, yeah, I guess I would just say, at the time, where was I when I was 20? It's like it feels like so long ago, which I don't want to say. I guess I was in college. I was in college when I was 20. I was actually, yeah, I was
Probably
the
right
right
after,
path.
probably right after high school,
Right. I was definitely in college. I was thinking
college.
about there was some confusion about med school versus what I'm going to do. I changed my major like a lot in school. So I would say to that person, like if you're still trying to figure it out, trying to, decide which way to go and what major to do, how to go about all of it, just keep doing your research, don't and trust that you'll make the right decision. Like don't be afraid, just continue to explore. Don't be afraid to like explore different options. I was a math major for like 2 weeks. I was I was a statistics major, and so I tried different things out. And
Right.
don't feel like because you don't know yet you
Mhm.
can't ever figure it out. Like you will figure it out eventually and it's going to be okay. So I think that's what I'll tell myself, that just calm down. It's going to be fine. It's okay to explore. You'll figure it out.
And a lot of people say something to that, like, don't take yourself as seriously and you'll figure it out. And so that's amazing. So thank you for that. Okay, so Dr. Shea, where can people connect with you or look you up and all that?
Absolutely. So I'm based in Sugar Land, Texas, which is a suburb of Houston, and you can find me at www.intouchprimarycare.com. That's our website. You can also find me on Instagram at InTouchPrimary or on Facebook at InTouchPrimary. and on YouTube at In Touch Primary Care. We have a YouTube channel, and more recently on TikTok at intouch.primary. So choose your platform and you can find me there.
You have options. All right, guys, you heard it. So we had a lot of gems for you today. Dr. Ashaye definitely gave some gems. So please like and share, because there's definitely someone out there that this could be beneficial to. And those of you looking for a primary care doctor, Apple Valley Medicine is accepting new patients. Our phone number is 304-350-1087. And you can find us online at www.applevalleyfamilymed. You guys have a great week. Thank you. Bye.